is going to give us a great talk. So we welcome all of you for today's great session. And today we have a very special, in addition to Dr. Shanmavalu, where did you locate Jayaprakash has come?
Yes, he's there. Sir, Jayaprakash, sir, say hello.
Where is...
Unmute,
did
sir.
I miss him?
Jayaprakash, you have to unmute.
Yes.
Jayaprakash, sir, unmute.
Very good. Very Thank you.
Now he's there.
Welcome, lovely to meet you all.
Sir, thank you. Welcome back, sir. We are. Thank you for accepting our invitation and coming.
Sir,
it was so nice of you.
Rangasamy, sir. Sir, Rangasamy, sir. Sandhya has also joined. You please welcome her.
Okay. Today is going to be a great session, and very many VIPs are here.
Welcome, Sandhya.
Thank you, Dr. Shanmugam. Thank you.
Welcome, Sandhya. Dr. Shanmugam told me next session is yours.
Thank you, sir. Thank you.
Sudhakar, I'll call you. I'm in a meeting. Thank you. Yeah, Dr. Shanmavalu, you can introduce both of them to Dr. Palaniswamy.
Okay. For JP and Sandhya, sir.
Yeah, JP is here.
Hello, sir.
Palaniswamy. JP is from Madurai Medical College, and he is 1 year senior to us, and he is from Madurai, went to England, done his MS, then plastic surgery, and he is interested in geriatrics also.
Okay.
Sir, I am having a call.
Okay.
You talk to her.
I will, instead of me telling about, Dr. Jayaprakash, now he should tell how he got, how he met our Guruji. That you can tell, doctor. That is the one thing which everyone should again know.
Okay.
So I request you to say, how did you, what was the first encounter with our Maharishi?
And in fact, it was very interesting. I heard about Maharishi long time ago in 1986-87 through Ramki. You know the actor Ramki?
Yeah.
Ramki, Nirosha Ramki. Ramki is a cinema actor. He came for treatment in 86-87 to me, 90. He told me about Maharishi. Then I was thinking of meeting Maharishi for more than 6 years. Then our Ayya from Pollachi Ayya, Mahalingam Ayya. Mahalingam Ayya came to London. Then I told Mahalingam Ayya, please take me to Maharishi. I've been waiting to see Maharishi 5 years. Then Mahalingam Ayya took me to Aliyar in 1996, introduced Maharishi 96. Then I come to Aliyar. I used to come to Aliyar 3 times a year from 96 onwards, regularly. And I had the opportunity to interact with Maharishi many times regarding spirituality and science and Kaya Kalpa. And he was really giving a lot of inspiration into Kaya Kalpa, Maharishi. So that's the way I got really fortunate to grow my knowledge slowly into scientific evidence of Kaya Kalpa with Maharishi. I took few scientists from Europe to Aliyar. I got more enthusiastic by Maharishi to go on anti-aging research and Kaya Kalpa. That is my
Thank you. Thank you. Thank you.
of interaction with Maharishi. I'm so fortunate to
It's
be with
very great.
Maharishi.
Now let me ask our Dr. Shanmugam to introduce Dr. Sandhya. She is coming first time.
Sir, Sandhya, in 82 to 85, she was my classmate in MS General Surgery. Then she did a project in the breast cancer. Now she is a specialist in breast surgery. And now they have formed a trust like that with the eminent oncologist in Bangalore. And they are running that for the sake of the people who have undergone cancer treatment and they are living after the cancer treatment. So they are treating, so they are helping them psychologically in all the ways. So they are helping dance, psychotherapy,
I have to adjust.
nutrition, and yoga. And so she is having a lot of connection in the yoga. So in that way, she is more connected. So I thought she will be a fit person in this gathering. That's why I have invited specially to attend this gathering, sir. Thank you, sir.
Thank you, doctor. I think she will take the same session next week at the same time. And we have with us Dr. Surendra Devi and then all other our scholars and all that. I think we should now take on with Dr. Palaniswamy. You can start off with your session. Thank you very much. Anything else Dr. Ravindranath wants to say?
No.
Dr.
Dr. Sutantra Devi. Dr. Sutantra Devi will give the review of the last meeting.
Okay. வாழ்க வளமுடன்.
வாழ்க வளமுடன்.
Welcome to Dr. Palaniswamy. Last meeting's event started with Dr. Rangaswamy welcoming Dr. Alphonse Murray. Dr. Rabindranath introduced his student, Dr. Alphonse, and was very happy that the relationship has been maintained for the past 4 decades. I read out the minutes of the previous meeting. Dr. Alphonse Marida started his presentation on structure and function of bone and cartilage in disease. He said he'll concentrate on disc diseases, osteoporosis, and degenerative bone disease. He started with the histology of the bone, which made the pathogenesis easy to understand. He listed the main causes of backache and the methods of diagnosis and the investigations required for each of them. And 40% is due to mechanical causes. And the next is trauma. And then inflammatory causes like rheumatoid arthritis, ankylosing spondylitis, and infective causes like spondylitis and tuberculosis, degenerative causes, osteopenia, osteomalacia, and osteoporosis, and neoplastic is primary and secondary. He explained the treatment protocol analysis with each center state. The IFT, pelvic traction to reduce pain in the acute state, and then physiotherapy, spinal and abdominal exercises, and back care to continue. He stressed that prevention is more for spine health. So exercises to strengthen the spinal muscles and the flexibility, yoga, he said, is very useful for this. Healthy weight we have to maintain so that the burden on the spines is less, and yoga can help here also. Of course, lifestyle changes. He said, sit smart, lift smart, and stop smoking. He clearly explained the degeneration changes of the knee joint with good slides and x-rays. So primary osteoarthritis is due to aging. The joint surface is getting worn out, eroded, and the cartilage becoming rough with osteophytes. So inflammation causes the narrowing of the joint space and restricting the range of movements. He said in India, it is common to find the medial side of knee getting affected due to sitting in sukhasana and squatting. He said the sedentary lifestyle coupled with the cross-legged position causes osteoarthritis in a younger age group. In the later age group, genovarum happens, which needs surgery. So he showed frightening pictures of the cartilage during surgery. And treatment of osteoarthritis, he said, in the beginning, it's analgesics, supplements like glucosamine and chondroitin, which were the normal components of the cartilage. They help in cartilage regeneration. And later on, it's the intra-articular sodium hyaluronidase and physiotherapy, heat, shortwave diathermy, all those things. And then specific strengthening exercises for the quadriceps and other muscles around the knee. He advised to take up walking first in short distances and then steadily increasing the distance. Of course, diet is important with high proteins, vegetables and fruits, and calcium with vitamin D supplements and anabolic steroids if necessary. Dr. Rabindranath allowed me to explain and counter the statement of Dr. Raghuraj in the previous session. Dr. Rangaswamy welcomed the senior professor Paramasivam, who was with Maharishi for a long time, to give his ideas about Maharishi's views. Dr. Paramasivam said majority of people, especially ladies who came to Maharishi, were to get cure from an ailment only. So he impressed that the energy aspect of Swamiji's system gave better results and cure to almost all the people. The energy, the biomagnetism, and the mental state improve with this program, giving relief to people. He quoted Maharishi saying, do exercise as meditation. Then Dr. Rabindranath spoke about his experience in people doing Sukhasana and having a healthy spine. So simple physical exercises by harmonizing the mind passes through all the stages of Pratyahara, Dharana, and Dhyana. And he said prana goes to the place where mind goes. So thinking of every part of the body sends energy to the whole body, so including the muscles, joints, bone, tissues, ligaments, and inner organs. So that way yoga helps in the constitutional problems like high BMI, high BP, high insulin resistance, high beta activity of the brain, and improves the quality of life. He was happy that even physiotherapists use Sky Yoga to get better results. So 14-point acupuncture and foot massage benefit even the inaccessible parts of the body like the abdominal viscera, heart, and lungs. So he explained the mechanism of Makarasana in segmental activation of the spine. So he requested Dr. Alphonse to design a research program for arthritis, and doctor agreed. That is 50 people of osteoarthritis after MRI will put into Sky Yoga and 50 people as controls, and the results to be evaluated after 3 to 6 months. Dr. Shanmugam said simple physical exercises with slow, regular all the muscle groups involved increases the strength of the joints and bones and prevents and slows osteoporosis. Makarasana, which results in the uniform stretch of all spinal muscles, corrects early disc problems. Then Dr. Dhanapati thanked Dr. Alphonse, and he stressed Maharishi's view that pain is because of obstruction to the magnetic circulation and the holistic approach of mind and the body, because mind is important both in causing and curing disease. Then Dr. Rangaswamy informed the group about the World Peace Award given to Maharishi on his 90th birthday by Dr. Vijay Gupta and Dr. Indra and her brother. Dr. Indra described the steps taken by them to get the Nobel Peace Prize for Swamiji, which didn't materialize. So they gave this prize through the trust. We are very happy and proud to know about you and this your love and dedication to Swamiji and your commitment to his cause to propagate peace all over the world. Thank you, madam. Dr. Vijay said it's a token of their love and gratitude, and we were all very moved. I requested Dr. Alphonse to design a study on osteoporosis, and he agreed. Dr. Shanmugam will stress that in case of ligament or meniscal tear, knee exercises should not be taught. Dr. Karuna said Sukhasana is our ancient wisdom that has given benefits, and why should we not practice it? Dr. Alphonse said, as long as you don't have problems, you can practice, but in case of pain, you stop. In early osteoarthritis, static cycling is good, but later on, walking should be started slowly, increasing the distance. Dr. Karuna also said psychosomatic problems in women are common, and they must be motivated to do simple physical exercises regularly to find the benefits for themselves. Dr. Alphonse thanked Dr. Muthamani for helping to set up this program. Dr. Rangaswamy thanked everyone, and the program was concluded. Thank
you, doctor. Be blessed by the divine. Thank you very much, Dr. Sundara Devi. I think more than, entire recap. Thank you very much. I must say, if I would have done it, I would have done half-baked. But Fantastic. It was totally covered everything, not a single point you have left. Thank you very much. And we once again welcome all of you. We have many eminent doctors and scientists over here. And we welcome once again all of you to the today's session, which we are going to listen from Dr. R. Palaniswamy Ayya. Topic will be a pelvic floor anatomy and application in clinical disorder of psychosomatic nature. Sir, over to you, sir, Dr. Palaniswamy.
Good evening to everyone, and I directly jump to the topic because already a lot of time is over. And
Okay.
sorry, anyway.
Thank you.
And this topic is actually very rarely spoken by any urologist, actually. And the disorder is still very, very rare. You know, I don't know how I got into this today. Pelvic floor anatomy and its relevance is more talked about by gynecologists, actually. Because in them only more disorders are coming in. But still, since you have asked, I'm going to tell you the, in a brief fashion, what is the anatomy of pelvic floor. Now, I hope you can see this specimen of bone, which is the bony pelvis.
Yeah,
Will
we
you be
are
able to
able to
appreciate?
see.
Yeah.
Very nice, very nice. Appreciated.
Yes, sir. So this contains, there are three bones, three bones on one side, another three bones, and in the middle, another bone united together to form a ring-like structure, which is the one we call hip, hip. So this pelvis has got a cavity, and the cavity has got an inlet, and also has got an outlet, So this pelvic cavity has got a floor, and that's what we are going to talk today, pelvic floor. And the pelvic floor has got double hammock, hammock, Tamil total solvanga, there is a hammock inside and there is a hammock outside, The inside is the pelvic floor consisting of musculature. Now, basically, there are 6 muscles involved in bridging this pelvic floor. The 4 of them are coming from the sides and 2 of them are coming from sides to fill the gap, fill this gap, something like this. I'm showing you a miniature like this. So you can see that can you see this, appreciate this?
Oh, yes, very nice.
Yes, doctor. We are able to see it. First time I am seeing.
Yes, so this is how this inner hammock is filled by muscles. That inner hammock main muscle is levator ani and coccygeus. The names of these muscles are mainly this thing. It arises from the side of the pelvic cavity and get united in the midline to form a raphe. Okay, so it is like one diaphragm. You call it diaphragm or like a hammock. This particular structure, muscular structure, is strengthened by some ligaments. Ligaments are actually condensed form of tissue, which gives more support to this pelvic floor. And this pelvic floor is pierced by 3 organs, 3 tubular organs in women and 2 tubular organs in men. In women, it is the urinary passage in the front, in the uterus and vagina in the middle, and rectum in the back. And in men, it is urethra in the front and rectum in the rear aspect. Now, coming to the external hammock. This is the external one. There is a diamond-shaped structure is here. It has to be your little imagine here diamond-shaped structure, and it is divided into 2 triangles. One you put this 2 line. This is one triangle, and there is another triangle. The front triangle has got the urogenital diaphragm. Urogenital diaphragm is something like a membrane, and in the front it has got tissues and some structures. And in the back aspect, we have got the anal triangle where the tissues are bridged by muscles, and then in the center you have got the anal canal and rectum, and surrounded by its anal sphincter. And in the front, it meets with the perineal body. Perineal body is a condensed tissue. Okay, so this is posterior triangle, and this is the anterior triangle, and both together it forms something like a hammock. So we had one hammock in the interior and one hammock outside. There are 2 hammocks. Now in the urogenital diaphragm, we have got some muscles like it is called bulbospongiosis and corpus cavernosus muscle, and we have got the surrounding tissues, and that is the superficial area. And the deeper area, we have got the sphincter urethra. That is the main structure we have got here. And posteriorly, we have got anal canal and anal sphincter. So this is briefly about the anatomy of pelvic floor. Now, pelvic floor as such undergo disorder, structural disorder, functional disorder. In many aspects, I am not going to touch all those things. I am going to touch only on particular aspect in which I noticed particularly in my practice for last 30 years. And it is unpublished data and unpublished work, but I collaborate with my psychiatrist to verify that whether my findings are correct or not. It is about a psychosomatic disorder. Now, this pelvic floor is a muscle, as I told you, the inner hammock. It is made, the tone of this muscle is maintained by constant the nervous supply, which maintains the tone of this. So always this acts like a very thick sheet of muscle which prevents. Suppose you stand, we stand, all the abdomen organs are going to fall down. It is being supported by the tone of that muscle and the ligaments, and also that outer hammock. So this is the anatomical basis. And because these three structures are crossing in women, the urethra, urinary passage, the vagina and uterus, and the rectum, and this structure is all surrounded by little concentrated forms of the muscle. In levator ani muscle, around these three structures are little bit concentrated. Now, what we have found in our urology practice is a lot of people come with complaints connected with these three organs. One is about the front is the urinary passage. A lot of men and women complain of constant discomfort in the urethra or a post-void discomfort, which is a very unlikely complaint in any urinary infection or urinary obstruction and things like that. That is one. Second, regarding the middle passage, we have got the vagina and the uterus. Some people present with dyspareunia, that is pain during sexual intercourse. And the posteriorly, behind, we have got rectum. They have got constant pain in the perineum and while defecating. So all these things, some people got combination of all the three tubular organs. Some people have got only urinary passage. So that's how we get into the picture. Now, I have seen people coming with the huge, big files, having seen several urologists, several surgeons, several nephrologists, then their problem is not all right. So we have to really think from out of the box fashion. And that is how when I examined, in most of the people, we found that there is a tenderness in the levator ani region, which we can do in a rectal examination in men, which is just above the prostate gland. You get the circular ring and there is severe tenderness in that area. In some women where they could cooperate and are using our gynecologists, I also examined in women, same thing, tenderness around the levator ani. So this made me think quite a bit, and then I treated them in a slightly different fashion than what is prescribed in the books and things like that. So this is a form of a psychosomatic disorder. That's what is the conclusion is, and it is countersigned by my psychiatrist. He has analyzed most of these patients again after me, that they have got a deep-rooted psychosomatic problem, and this is one of the presentations. As you all know, psychosomatic problems can present in various ways in our body. Some people can come with headache. Some people can come with just myalgia, fibromyositis. Some people come with palpitation, then acidity and irritable bowel, and so many things, so many various ways of this stress present itself in the body. And we call it psychosomatic because psycho is the source and soma is the body. Psycho means it's the subconscious mind which has trouble, and it doesn't have a representation in the body. So the soma means body. Body is affected. So that is our psychosomatic condition. Okay. So it very rarely this is presented in urinary tract, and I would have seen about 100 patients in the last 30 years, and I'm able to really. But before coming to this conclusion, we also do routine investigation, urine examination, then blood functions, blood test, then ultrasound scan, and sometimes transrectal ultrasound scan. All these things to rule out really they have some other disorder or not to produce the symptoms. Then once we exclude all these things, then it is a psychosomatic disorder presenting as the pelvic floor spasm. This is due to the spasm of pelvic floor muscle in the midline, in the midline. So around the urethra, around the vagina, around the rectum. So this is what it is. And about 90% of these patients can be treated by the urology, like I myself can treat, because they have more confidence in the doctor who has seen and diagnosed first rather than going to psychiatrist. If you tell them to go to a psychiatrist, they have got a lot of reservations, a lot of them don't go. So I start with medications. I give them, first of all, I give them to do sitz bath. Sitz bath is taking hot water in a plastic tub and sit there for 5 minutes in the morning and evening. This is supposed to relax the pelvic floor. And I give them medication called alpha blocker. And also with all these things, I also add a mild anti-anxiety drug like venlafaxine. These are all drugs without much side effect. So I give them a schedule like this and review them after a month. And in a month's time, the progress is very good in most people and marginal in some people, average in some people. So these people I analyze again. Sometimes I raise the dose of the antidepressant or venlafaxine, and ask them to do cycling. Cycling is another way of relaxing the pelvic floor. Then sitz bath, all these things. And then also in addition, I advise them to do brisk walking. Brisk walking relaxes all the muscles. Now with this, more people get into the recovery zone, and then I see them after some time. Then I maintain this medicines and schedule for some time, and then taper off and this thing. Now, there is about 5 to 10% of the people who have got a really deep-rooted problem, and their problems are very difficult to manage from a non-psychiatrist like me. So I put them onto a psychiatrist, and psychiatrist confirms the diagnosis, and he has got his own group of drugs to put and things like that till the patient becomes all right. So this is about the psychosomatic disorder presenting as pelvic floor spasm. I don't know whether this particular information will be useful to your group or not, but still, this is what my experience, and this is yet to be published anywhere, and it's not published, in the textbooks. So this is how it is. The present situation is like this.
This is what I wanted him to present for the day.
Sir?
This is what I wanted you to present today.
Okay, sir. I got it. Yes, I've done it. I've done it very briefly, I think.
Right. Okay. So the spasm of the muscle is
pelvic
causing
floor. Yes.
the pelvic floor muscle, levator ani.
Correct.
Causes
Tamil
pain.
Sadapuditam solluvom Tamil.
All right.
Same thing.
Right. Okay. And now I just want to tell you something about the other way. The lax muscles, the flabby muscles, which create problem, which is of interest to Dr. Jayaprakash also.
Yes, sir.
And right. So when with the age or with the malnutrition, the general body condition, the muscles become weak, especially as we grow old. When the muscles become weak, they fail to support the bones in the usual way. For example, in the knee joint, the lax muscles of the thigh fail to hold the tibia and fibula together. They leave a gap. People with this condition, they complain that they get a noise when they walk. The femur hitting against the tibia. And similarly, they get some noises with the changing position of the neck or in the back, which was not there as long as they were having normal muscle tone. So these lax muscles predisposes the joints for more injury because of the dead space that develops between the two opposing joint surfaces. And that is resulting in OA and degeneration of the articular surfaces. Now, if you look into the same laxity of the muscles, it is affecting globally in the body. The pelvic floor, when it becomes lax, and when the colon muscles, they also become weak. What do you get is constipation. You have to strain a lot and use external pressure, abdominal pressure, and trying to compress the colon to evacuate, which is very, very circuitous way. And even when the colon tries to expel, the lax pelvic floor is not supporting it, and the constipation becomes obstination. So it is prolonging. In the same way, the bladder, when it becomes lax, weak, you get the residual urine. And you get an interesting thing with the eye. When the ciliary muscle becomes weak, it fails to adjust the liquid lens focal this thing, and they develop the refractive errors. And this can be projected to some of the unseen areas. See, the kidney, nephron, the convoluted tubules, when they become weak, then they become ecstatic. The lumen size increases. The function of the kidney gets affected. And similarly, you can consider any muscle in the body creating a problem because of the loss of tone and the laxity and the flubbiness of the muscle. And the point of interest to Dr. Jayaprakasham and Dr. Devi and all is the sphincters get lax. They don't perform their function in the normal way. The old man gets a regurgitation, acid regurgitation, because of the cardiac, the gastroesophageal sphincter becoming lax. And similarly, the seminal vesicles, the sphincter there, when it becomes lax, the result is leakage of the semen in the urine in small quantities. This is exactly what the Siddha doctor, practicing doctor, asking for the morning first urine specimen. And he identifies by his own Siddha methods the presence of sperms there. And this laxity of the sphincter of the spinal vesicles allows a constant unconscious leakage of the semen and the vital fluid in addition. So this is one condition which is essentially responsible for the overall negative health in the elderly. And this is easily corrected by exercises and sky yoga practices. Kayakalpa helps it, and this is one reason why the senior citizens who may not be producing that much of the semen because of the deteriorating function of the testosterone levels and the gonadal functions. What they have is constantly lost, and that is relevant to our things. While you are telling about the spasm of the muscle, I was just trying to explain the weakness of the muscles. Both are giving trouble. We can, I think, discuss what I said. What Jayaprakasham, what do you say?
Dr. Palaniswamy has given a very clear, beautiful description of anatomy of the pelvis. I was so happy I listened to him. And I'd like to ask one suggestion, Dr. Ravindranath sir. When we do the Kaya Kalpa, what are the muscles in the pelvic floor we use maximum? I'd like to know the correlation of the Kaya Kalpa exercise, the pelvic floor exercise. Which are the main muscles we contract and which are them put into action during Kaya Kalpa? Please explain to me.
You know better. Anyway, I'll tell you. It is the
Yeah, please. It comes from you. I'll be very happy because my knowledge of that is very less.
It is the pelvic floor muscle, mainly contributed by levator ani, and the other muscles like the pubococcyx, bulbocavernosus, and sacrococcygeus. These muscles are filling up the gaps, and I don't know really what are all doing.
My little suggestion for
I think the anal sphincter is also involved in your Kaya Kalpa.
Right. I want to suggest to one of the younger, the MSc graduates or PhD students in Sky to do an MRI or an ultrasound scan during the effective Kaya Kalpa.
Ashwani Mudra.
I call them Ashwani Mudra, the dynamic MRI or ultrasound to see exactly which muscles is predominant and how coordinated movement occurs, because it's very, very important. Why I'm saying that, then we can say, demonstrate Ashwani Mudra, where the pelvic floor dynamically, effectively working. Because I did a small study I want to share with Dr. Pranivellaya and you. I made a naturopathy doctor, Dr. Kausalya. I think she's practicing still in Chennai. Yeah, I took her to London after trained in Alia. For 2 months she was in Alia, got trained. And then I brought her here. I kept her for 1.5 years in London. I did a study with a gynecologist in Royal Free, selecting 15 patients. We did an ultrasound scan for the pelvic pain patients, because most of the pelvic pain patients, low back pain, they go to gynecology or urologist or a spinal surgeon. So the gynecologist did an ultrasound scan of the pelvic pain patients. 60% of the women having varicosity of the pelvic veins because of the lack of muscle tone, pelvic vein plexus varicosity. So we did the Kaya Kalpa 5 days a week with Kausalya. I trained her, and we did the ultrasound scan after 3 to 6 months on that 15 patient. The pelvic floor varicosity, especially varicose veins of the pelvic floor, dramatically reduced 60% just by Kaya Kalpa. Because developing the muscle strength in the pelvic floor, muscle strength, and squeezing the pelvic veins, drain the pelvic veins, so the varicosity is less, and the hanging of the veins lying on the muscles, giving the ache, stretching the nerves, parasympathetic and sympathetic nerves around the veins. That stretching is less, the pain was less. So the gynecology, Dr. Abdul Gadir, was so fascinated with this research. She said it's one of the best one for gynecological rehabilitation, as well as urological rehabilitation and pelvic floor plexus. Unfortunately, after 15 patients, we couldn't get an ethical approval because of a lot of what I call is the nitty-gritty of the system in here. the ethical approval committee was very hesitant to get that going on. Then I had to stop it. Now I need to restart the ethical committee approval in India, especially with the PhD students, the dynamic activity of the pelvic floor, which are the muscles intensively working, which are the ligaments intensively working during that exercise, and how the veins are thinking. And another, I think I want to connect with the Dr. Palaniswamy sir. He was given a very interesting psychosomatic disorder thing. In Harvard University, initially, they agreed most of the disease was less than 20% was psychosomatic. That was 15 years ago. Recently, they accepted 40% of the diseases are psychosomatic related. And also, now to make the life easy, last 15 years, I've been doing neurotransmitter evaluation, especially the parasympathetic, sympathetic neurotransmitters evaluation. The excitatory inhibitors or, excitatory neurotransmitters or adrenaline, dopamine, noradrenaline, and all, and inhibitory neurotransmitters are serotonin and GABA. Now they found the link. If people get psychiatric illnesses, the neurotransmitters get haywire. And especially the neurotransmitters inhibitory, serotonin controls the estrogen and GABA controls the progesterone. So by irregularity, the muscles gets irregular, the hormones effect on the organs gets irregular, and the effect of the hormone imbalance through neurotransmitters get erratic. By Kayakalpa, Ashwini Mudra, we are balancing the sympathetic parasympathetic, that is the excitatory inhibitory, because Kayakalpa increases the parasympathetic activity, increase the secretion of serotonin and GABA, and regulate the parasympathetic activity, suppressing the sympathetic activity to control it. So my finish of the idea was dynamic MRI or ultrasound to assess which muscles really working during the Ashwini Mudra. Second, how parasympathetic, sympathetic by neurochemical. I do a lot of urinary neurotransmitter evaluation by working the neurotransmitter evaluation of GABA, serotonin, and dopamine and all, and also do the salivary hormones. It's easy. You take saliva and estimate the hormones. So by doing that, we can establish the real scientific evidence of Kayakalpa, Ashwini Mudra effect on gynecological, urological, and also orthopedic things. So that is my real aim, to get a PhD students to work along in this direction with that. Thank you.
Very well said, sir. On behalf of the PhD students, thank you for giving this project to them. And
I can guide them along with that.
Yes. That is a bonus. And now your studies, the ultrasound and the dynamic MRI.
Yeah.
Which muscle is acting in Ashwini Mudra?
Yeah.
I'm putting back the question.
Back to me. Oh God. I think Dr. Palaniswamy sir will be the right person.
No.
So if
he has not done any studies in this.
If you ask me, is most of the levator ani is the biggest muscle.
Yes.
You know, out of the two diaphragm, he said, the hanging diaphragm, the largest muscle is levator ani.
Yes.
And then all the sphincter muscles, like a anal sphincter, urogenital sphincter, all the sphincter muscles around the orifices. So especially when we contract and we hold them up for a few seconds before we draw, in Ashwini Mudra, when we hold them up, we are really squeezing the muscles and increase the tone of the muscles. And especially we are increasing the mitochondrial activity of the muscles. Because as you rightly said, when we get older, the mitochondrial activity of the muscle goes down because of, we call them lazy mitochondria. Mutant mitochondria is active mitochondria. So by contracting the muscles, one, we are increasing the activity of the mitochondria, energy of the muscles will increases by Kayakalpa. and regulate the neurotransmitter and hormone activities. And the dopamine is very important for testosterone, for the muscle activities. So that is why I feel we need to have a scientific, dynamic video graphic MRI pictures during Kayakalpa, how muscle contraction occurs, how the venous circulation goes around, arterial circulation going around. And that will give a real classical impact on younger generation. Hey, this is the most scientific evidence we have.
This dynamic MRI can be taken with a usual machine, or it requires anything?
It is a dynamic MRI is a separate MRI.
Separate MRI.
Yeah, separate MRI. Like a
I think
higher version.
Nimhans Bangalore has it.
Yeah, higher version. And also, if it not, at least we can look at the ultrasound. The 3D ultrasound. 3D, you know, the gynecologists use 3D ultrasound. That 3D ultrasound also can measure the width of the muscle, depth of the muscles, and the circulation of the muscles. MRI may be expensive and radiation. Ultrasound
dynamic ultrasound.
Yeah,
will it show the contracted state and the relaxed state?
Yes, I have a very.
We can identify which fibers of levator ani.
Excellent, because I have an excellent radiologist. I have excellent radiology friend in London. Her main work, that lady work, is all muscles with the ultrasound scan, 3D ultrasound. She assesses all the back muscles with ultrasound and all the leg muscles. So that ultrasound has to be very high intensity, depth 3D, to go into the pelvis, to pick up the muscles, length and width and contraction and the fibers, along with the vascular circulation.
In gynecological problems, they do vaginal, intravaginal.
The transvaginal ultrasound scan. That can be also useful, or external. We can do both transvaginal and external ultrasound.
Both combined together.
In a better way to do that, that will give a real encouragement for the younger generation. Yes, this has got an effect on musculoskeletal system. As you rightly know, 40% of the blood circulation to the bone is only nutrient artery. 60% of the bone circulation only through the muscles. So contracting the muscles and making them more harder, it also increases circulation to the bone to prevent the osteoporosis. So by doing the 3D ultrasound scan, we can really classically demonstrate how Kayakalpa can do the, not only the musculature and the ligaments, plus activation of parasympathetic nerve fibers in the pelvic area, in the perineal area.
Now I will invite Dr. Swatantra Devi. In Dr. Devi, you have an obstetrician, gynecologist, and
I hope I'm not crossing her side of it.
No.
My knowledge is very little.
We are discussing freely, and she is an acupuncturist also, successful acupuncturist, and she is a yoga practitioner and teacher.
Excellent.
So I invite Dr. Devi.
Please.
Yes, Dr. Sundra Devi, very long since we have been waiting, Dr. Jayaprakash, to interact with you, and the day has come. Please go ahead.
Thank you for asking me to talk. Of course, today's program was an eye-opener. Dr. Palaniswamy, he said the psychosomatic aspect, we have never thought about it so long at all. Though I've been practicing obstetrics and gynecology for 45 years, this is the first time I am thinking in that angle, you know. And of course, in my practice, it's mostly obstetrics. And I know that the pelvic floor muscle is the most neglected muscle. Nobody exercises the pelvic floor muscles. But because I learned yoga early on, from 1980 onwards, I've been teaching my patients in the antenatal area. I take yoga classes for natural childbirth. So I make it a part that the Ashwini Mudra and Moola Bandha mainly, that systematically I ask them to practice. So I see that there is a lot of less necessary for episiotomy, or even if I have to give, the pelvic muscle is so strong that it can stand the stretch of the delivery. and maybe a short episiotomy will do. And I've seen that the episiotomy heals faster, and the pain of the episiotomy is much less in patients who've been really practicing Mula Bandha regularly. And because these muscles support the pelvic organs, see, when there is the laxity, as doctor said, when there is constipation, when there is a pregnancy, when there is obesity, there is a lot of pressure from above. So they get into so many problems like piles and prolapse of the uterus and urinary incontinence. So in my practice, because teaching yoga, Ashwini Mudra regularly and Mula Bandha, I have seen that these problems are less. And of course, they're happy after delivery also. So that's all I have been doing in my practice. But the first time today, I'm very happy to meet Dr. Jayaprakash, because I've been hearing so much about you, sir. And this is the first time I'm hearing about the vascular aspect of it, that the pelvic vein varicosity is one of the causes for many problems. So this it's really news that it is reduced after Kaya Kalpa. Of course, definitely, when the muscles contract, the blood is evacuated from the muscles and stagnation is prevented. So definitely it will have a very good impact on the pelvic blood circulation and give the results. So, and the other thing is about the sympathetic, parasympathetic, Dr. Jayaprakash said, but the levator and a muscle contraction, we were actually talking about in our earlier sessions that, see, the parasympathetic nerve, S2, 3, 4, the pudendal nerve supplies the anal sphincter and the levator and a muscle. That it has got both the sympathetic component, parasympathetic component, and the central nervous system, the motor nerves. So voluntarily contracting this, according to yoga, or my Guru Swami Satyananda, what he says is, first you start the voluntary contractions, and that induces the stimulation of the parasympathetic nervous system. And there are only two places where the cranial aspect and the perineal aspect for parasympathetic activation. So this perineal parasympathetic activation takes place because of a voluntary contraction, and then it takes over. And this parasympathetic activity neutralizes the sympathetic overtone, and generally in the body, it brings about a sympathetic, parasympathetic, the balance. So counteracting the overactive sympathetic nervous system. See, that is how in this group we have been discussing. But of course, it's an eye-opener to know about the neurotransmitters and the action also of the sympathetic system. So thank you both doctors. So that's all I would like to say.
Made it finally.
Okay, now Palaniswamy.
Yes,
Palaniswamy.
Dr. Palaniswamy.
We tried to rejoin. We tried. He left.
It appears he has.
I will rejoin.
We'll just disconnect it.
Yes.
Okay.
I think he was in a hurry because we started late.
No,
he was to give 1 hour. We gave him total freedom.
His
He must have been got a call.
for the day ends by 9 o'clock. So
yeah, he by 9. Yes.
Yes. Okay, I requested him to take leave from his daily routine for the day.
That's a good idea.
Okay. Now, Dr. Dhanapati.
Can you hear me?
Yes.
Yeah. See you.
Thank you.
If you open the video, we will see you also.
There is some problem in that opening the video.
Okay.
I would like to thank Dr. Palaniswamy for the wonderful presentation. And regarding the pelvic floor, the muscles we are discussing about, and he said that there is if there is a problem in pelvic floor spasm, that will leads to a problem. that is due to the even psychological problem also.
Yes.
But along with that, Dr. Rabindranath also said that if there is a flabby muscle, that means if there is a loss of tone. So one is loss of tone, another is spasm. So both the things can be corrected with the help of the pelvic floor yogic exercise called as Ashwini Mudra. That's what we have understood now. And there is a question raised by Dr. Jayaprakash. Have we done research on how the Kayakalpa is really working? Actually, I have seen some literature in which there are some studies already there. So I think by one Dr. Mrunjaya Rotar, he is an anatomist from All India Institute of Science. So he has very studied detailed research on the yogic exercises. So in which when Ashwini Mudra is being done, the anal sphincter will be get activated. He says that pubo analis and pubo erectalis. So both the muscles will get activated. And in case of Mula Bandha, pubo perinealis will be getting activated. So these are all the study by him. So by doing all this exercise, especially Ashwini Mudra and Kayakalpa, so that the sphincter and all the muscles, levator ani and all the related muscles will get strengthened, so that there is a possibility of coming out of urinary incontinence. And some people after the childbirth, a lot of problem in pelvic muscles, the weakness in pelvic muscles, and that can also be corrected. And as Dr. Rabindranath said, that when we do Kayakalpa, there is a possibility of reducing the leakage of semen. All these things, by knowing all these things, we understand that by doing Kayakalpa Yoga, the pelvic floor muscles are getting strengthened, and both contraction and relaxation. So tonicity of the muscles are happening, so that this exercise will help. So far, according to my understanding, and after going through the literature, so far done by some researcher, especially in All India Institute of Medical Science. So I think, yeah. So this is my understanding, and thank you so much for everyone. Thank you, sir.
Okay, Dr. Karuna, please. Dr. Karuna. Are you available?
She is available.
Yeah.
She is
Sorry.
trying to unmute.
Yes,
Yeah.
yes.
Welcome.
Okay.
Welcome,
Welcome.
Dr. Karuna.
Good evening, sir. So good evening, every one of you. And I think I spoke without unmuting, right? So it was a nice, very nice presentation by Dr.R. Palaniswamy, sir, especially for the gynecologist. That is the area where we deal with most of the time. And he said about the levator and spasm, I think, which has been the reason for so many diseases, which we cannot find out the causes for a few when the people present. And also Dr. Jayaprakash had said about the levator and veins, encharged veins like the popliteal veins, which we see externally. One thing which I want to say is, I think the MRI, dynamic MRI, as you said, it's costly and we get more of an exposure to magnetic. But we can do an ultrasound, which you all said, that is a transvaginal ultrasound, which has got a 10 megahertz, that can be kept as a skin ultrasound. So we need not enter the probe into the rectum or into the vagina, but it can be kept in the perineum. And we can ask them to do the exercises, and we can measure the thickness of the muscle and the laxity of the muscle when they do. I think that will be a better choice than MRI. As he said, one of the sonologists who is very much interested in doing that in London, who is very well versed with that. I think if she could give us an idea about how to measure and all those things, if we can have a class with her, I think we can also do that measurements with the transvaginal probe, which can be kept in
Whom
the
do you
period.
think?
Many of the
Whom do you
cases we
think?
do, sir.
Whom do you think in Coimbatore will help us, the sonologist?
The sonologist with us, I think, let me find out now. She must be interested in this, and she must have some free time to spare for this research work. Let me find out that.
Okay.
So I think we need to find a lady gynecologist who can help us. We have.
You are the lady gynecologist.
Yeah, that is what. So we have Dr. Sumitra also, who is the wife of a pediatrician. Maybe we can ask her. We can ask her to help. Let us find out now who can help us.
Common scan Vishnu Priya is there.
Eningma Vishnu Vaman scanner. Okay. I think they are also interested in a bit of research, like. Okay, we can ask her. I think Sundarama can ask her. And this will be of use, like that is what I wanted to say you. And one more thing is and we have so many people with who present with the fissure in ano. Many of the times that too during the summer seasons, we get many of the people have a fissure in ano. And how can these people be helped out with the Kaya Kalpa? Is there a chance? I want to ask Sundarama and...
No, piles, I have a lot of experience. So even the pile must persist, but the pain is not there. The other problems, the bleeding, all those things have stopped. A lot of people with piles, they benefited by this Ashwini Mudra, Bandha. But fissure, I have no experience.
Okay. That is also one area where we need to work
Dr.
on that.
Jayaprakash, you want to add something?
Yes, sir. And before I add that about the fissure, I like to ask Karuna ma'am and Devi ma'am one thing, because they both are gynecologists. They can clear my doubt. It's been in my mind a long time. You know, the Western literature called Kegel's exercise. I'm sure they heard about that.
Yeah.
Kegel's exercise. Because I have to teach people in London, it is the Kegel's exercise is a modified Ashwini Mudra. Ashwini Mudra is thousands of years. Kegel's exercise up like 20, 30 years. Do you think the Kegel's exercise, that what it's been, is it the same as Ashwini Mudra or modified? Or do you, if you in your gynecology literatures and books and everything, I'm sure you might have heard about the Kegel's exercise. I want to explain to the common people, what is Kegel's exercise?
Dr. Devi will help you. Dr. Devi will help you.
Yeah. What is Ashwini Mudra? What is Kegel's exercise? Are they modified or is the same?
Yeah, it's not the same. See, the contraction of the urethral sphincter is called Vajroli Mudra.
Okay.
So Vajroli and then Mula Bandha is contraction of the vaginal muscles and the levator and muscle as a whole, lifting the perineal body actually up. Then Ashwini Mudra is the contraction of the anal sphincter. So these three are different ones. So Vajroli we call it in men, Sahajoli we call it in women. So that is Kegel's.
So Ashwini Mudra is only contraction of anal muscles.
Yes, only anal muscle.
So it doesn't contract the urethral and vaginal muscles. No.
No, vaginal muscle and the perineal body, contraction of the whole perineal body away from the floor. And we teach them by keeping our 2 fingers in the vagina and asking them to contract it over our fingers. So for us ladies, I mean, gynecologists, it's possible, but otherwise it's not.
Difficult.
And then For this thing, contracting Kegel's exercise is taken from yoga. It is called Vajroli Mudra. Of course, yoga
So
separates.
Kegel's exercise is mainly contracting the vaginal muscles around the
Urethral sphincter, only the urethral
urethral
sphincter.
sphincter, only urethral sphincter,
Yes,
not the vaginal sphincter or the
the
things.
urethral sphincter.
Yeah.
And in men, it is called Vajroli. Ladies, it's called Sahajoli. Go into the Bihar school things if you have, or I'll even send you the literature on the
So Vajroli or Gejoli, it is a urethral sphincter contraction. That is Kegel's exercise. That is Kegel's.
That's exercise. Yes.
I've been confused, and thank you very much for clearing me, because I've been confused. I thought the Kegel's exercise is a different form of modified of Ashwini Mudra, I was thinking. Yeah.
And how our Swamiji has taught us is he used to make us do all three separately, each one, not the whole, of course, not the whole.
That is why the ladies, they call deer exercise separately. They've been taught in Kayakalpa.
A little different. I think Aruna is there. She will tell you about it.
The deer
But
exercise.
Yes,
Yeah.
yes.
I'm clearing a lot of things. Thank you very much for today giving me that.
So thank you for
Deer
coming.
exercise is totally different from the Kegels and the Ashwini.
Yes,
Mudra.
yes.
It's different.
Okay, okay.
That
As
Aruna
Dr.
will,
Devi was telling,
Yeah.
as Dr. Devi was telling, you can contract the anterior part of the levator ani, the
Okay.
middle part of the levator ani, and the posterior part of the levator ani. The posterior is the anal sphincter,
Yeah.
and the front one is the urethral sphincter.
Is it do all the three and in sequence, or we can do one at a time? What do you think?
You can do all the three together,
Yeah.
or you can select one and do it, or you can do it together also. The vaginal and urethral contraction can be performed together, and anal sphincter separately can be done, and all the three can also be combined.
When you
And,
say Kayakalpa, is it all the three or only sphincter contraction?
Swamiji used to say the urethra should not interfere, it should not be included in the Ashwini Mudra.
Okay, in Kayakalpa is only anal sphincter area, not the
Anal sphincter and vaginal,
vagina, but not urethra.
not urethral. The location of the Muladhara is just above the perineal raphe, perineal body.
Yeah.
That is where the vagina is. The cervix is there.
Okay. Okay.
And I will ask Aruna to explain about the deer exercise.
WhatsApp number adene, phone pay number adene.
Muthumani has to
Dr.
unmute.
Dhanapati, mic mute பண்ணிக்கோ.
Mute பண்ணிட்டேங்க.
Right, right.
Dr. Indra Gupta would like to say, Dr. Indra ji, you are coming.
Well, this is a
welcome.
little bit off the track right now, but I am interested in having a strategic activism to break the firewalls with the medical system. What is that interface? And I have a solution to deal with this, because, when we want to add all these alternative complementary systems to main well-placed medical system in the world, how do we tackle that? I think that time has come for all these doctors who are trying to make it like an interface with yoga or alternative approaches in India, a petition, a worldwide petition to say from the patients who have been benefited by this interface. I think that can be a very good start, and I want to know views of Dr. Jaiprakash that, established medical system has a lot of firewalls. We have to really penetrate that by strategic activism from the people who have been benefited. How do we do that?
Yes, ma'am. It is an ideal base, our sky research center is the ideal base in India, because here getting ethical committee approval for all this is much tougher.
Yes.
In India, Sky research system with Ayush and ICMR is much easier to do the system. So that's why we need to be very effective using the modern biomarker tools like ultrasound, MRI, and salivary test, neurochemical test. Using these, then they cannot say no, because the modern tools, it will prove the effect of them.
So we need the data.
Yeah.
And that's what we can concentrate. Maybe the young doctors can concentrate on the data, which gives that interface some validity.
You hit the nail on the head.
Yes, and I think that's where we can engage young people to just do that.
This is why I'd like to request Dr. Ravindranath sir, we need to get the PhD students also coming to this meeting.
One of the PhD student is going to.
They are all here, Doctor. Already there are about 5 PhD scholars are with us. They are quietly receiving you.
Excellent, excellent. I like to teach the younger generation more rather than we discuss ourselves. And we also get educated when we teach better, like sort of.
Yeah.
Aruna
is there, and
Tamarai is there. Hema Malini is there.
Shankari is there, and Shanti is there.
Yeah.
Yeah.
In that case, we really have to give the responsibility to the younger generation to get it going.
Of course, that is a great idea of Dr. Ravindranath. He has called PhD scholar. In fact, last couple of weeks they were presenting. They were given assignments and they have presented it. And so thereupon
rightly Dr. Gupta said, we need to get into action. That's why the younger generation make much more into action.
I think both of you are emphasizing the same point of bringing the youngsters to the floor.
Absolutely.
Thank you.
Absolutely.
We are also encouraging it.
Absolutely. I am allowed to teach them and learn from them and get it going more fast forward. Yes.
Excellent.
Yeah.
PhD
and Dr. Karuna was going to explain something. And
yeah. Dr. Karuna, you have something to say?
கருணா மேடம் மியூட்ல இருக்குது நீங்க பேசுறது
சரி
please unmute.
Yeah. So during the antenatal period and towards the later months of the pregnancy, we have got the varicose veins which are seen in the perineum. But these veins around the levator ani, this is the first time we are hearing. So what made you think about it, and what made you look into it really with ultrasound?
Actually, the gynecologist said most of the women above 40, the pelvic pain, the low back pain, is mostly due to pelvic calcium rather than the spine or muscle problems. The heavy pelvic veins stretch the nervous system to give the irritation of the pain. So he looked at it. He is a 3D ultrasound scanner. He himself did the ultrasound, the gynecologist. Dr. Gadir, he's a professor. He's retired recently. And he told me in his examination of the ultrasound, most of the women who has a back pain is not due to the back, the spinal muscles or spines or the pelvic things. It's mostly due to the heavy amount of veins varicosity stretching the whole pelvic muscles, causing the pain. He used to inject with some sclerosing agent to reduce the veins, or he used to inject, even excise the veins. After the kayakalpa, he was amazed. The veins were shrinking really well. And he was very surprised. The pain of the patient was recovering very fast. So in the differential diagnosis of the back pain, we need to look at the pelvic flexus varicosity as well. not only the bones and joints and muscles, we have to include the pelvic vein precocity. For a lady above 40, 50, the differential diagnosis of the pelvic pain is the pelvic plexus varicosity. And regarding the fissure in ano, is it mostly the excessive contraction of the muscles, anal muscles? And mostly the parasympathetic activity. Sorry, sympathetic overactivity. So with the Kaya Kalpa, you are increasing the parasympathetic activity, as you rightly said. So it neutralizes the sympathetic activity to calm down. So the muscle spasm reduces. You know what I do now? I do, if people don't like yoga, I inject them with the Botox to relax the muscle. So because I'm a cosmetic surgeon, I do a lot of facial Botox. So now to treat the fissure, I inject Botox into the muscle to relax it. Then I tell them, come on, learn the Kaya Kalpa and relax your tension. Like a fissure in ano is a modified effect of psychosomatic disease, stress-related spasm of the muscles.
What you said is right, sir, because when the fissure is ano is very painful.
Yeah.
Because we cannot do a PR also. Sometimes when we do PR with the fissure in ano, patient may go for a shock.
Absolutely.
With the pain shock, we may lose them. That is how the pain and the tenderness will be with the fissure in ano. So in those cases, as I said, we need to relieve the pain at least for a week. We used to give anti-inflammatory painkillers for 1 week to 10 days. Because when the pain is there, more and more spasm is going to be created, more and more sympathetic and more and more. So we need to make them get relieved of the pain. So very effectively, we need to manage the pain, and then we can start these exercises.
Yeah, absolutely.
So
Now
the
fissurectomy is reduced since we started injecting Botox and relaxes their mind. The pain relief is the main factor. Once you release this, and then digital, what you call manipulation.
Stretch.
Stretch. So that we reduce the amount of fissurectomy just by Botox and the fissure, what you call the digital stretching, dilatation. That's right. Thank you.
Okay.
Aruna, are you ready? Tamarai, can you pull out Aruna?
What is volume, sir? I'll check one.
Okay, while she is getting ready, Hema Malini, madam, can you give your ideas?
If
you don't mind the video, please.
Bandwidth is very low, sir.
Okay. Please.
So we are getting so many ideas about for our journals, sir. Sir?
Yes.
We are getting so many ideas for preparing for our journals. So many feedback we are getting, and we are happy to have a vast idea on all the areas, sir. So it's been a very wonderful session for people who are studying in this field. We're getting n number of ideas from all the learned persons. We are happy for this.
Right. Thamare, madam. Thank you.
Thank you, sir. Thank you. Thank you for the opportunity.
Thank you, Ma. Thank you, Emma.
Thank you. Thank you, sir.
And what PhD is called? I'm sorry, sir. Can I ask?
Oh, yes.
Yeah, surely. Emma, can you just tell about your...
Hema Malini, you are a PhD scholar now.
Yes, sir.
What specialty you are doing? Can I?
I'm doing it for diabetic patient, type 2 women patients, sir. Type 2 diabetic patients.
And you are basically, what is your qualification, Dr. Hema Malini?
I have completed my MPhil in yoga, and now I am in the final stage of completion of my thesis.
You are MPhil in yoga. Now you are doing PhD.
Yes,
in
sir.
Diabetic.
Yes.
In diabetic, what?
Type 2 diabetic patients in Chennai.
In what is
Yoga
your title?
intervention.
What is your title?
Simplified Kundalini Yoga. As our system only. Simplified Kundalini Yoga.
Can I give you a little suggestion for diabetes?
Yes, sir. Yes, sir. True.
Okay. One of the commonest things that people in India or even in Western countries ignore for type 2 diabetes is stress.
Yes.
Because I have seen time and again, I have done a lot of diabetes reversal. Patient comes with 60 units, 70 units of insulin. I completely stop them within 6 months, 9 months. Totally. Because most of the diabetes, they just ignore the management of stress. The type 2 diabetes is due to insulin resistance. That if you measure the insulin of the patient, they will have a high insulin.
Yes, yes.
But they are not insulin working. Because why insulin is not working, the cortisol makes the insulin resistance. So they don't measure the cortisol. The diabetic patient or even the big diabetologists, they don't measure the cortisol level. They only increase the insulin level more by looking at the sugar, but they don't look at the root cause. Noi nadi, noi mudal nadi.
Yes.
The type 2 diabetes is high cortisol content. Makes the insulin resistance. So their own insulin does not work because of high cortisol. So if you could please include in your PhD research, the cortisol yoga. The sky reduces the cortisol level.
This time I'm using questionnaire for this, sir. I didn't measure the cortisol level, but I have used a questionnaire for this.
You must. If you don't, you are a yoga specialist, MPhil. You must measure everybody, the before sky level cortisol level, after sky level cortisol level. Especially the cortisol varies a lot. In the morning, you have to measure because the cortisol hormone secretes between morning 1 to 3. So morning 7, 8 o'clock cortisol is the highest. You must measure. And then soon, I'm going to get this lab started. You can have a salivary cortisol level 4 times. Saliva cortisol level indicate how it influences the insulin function. I'm so glad I asked you because this is very important in yoga, sky yoga, how it reduces the cortisol level and reduces the adrenal fatigue. When the adrenal pump more and more cortisol, and the adrenal gets tired and the insulin doesn't work. And nobody looks at that point. You are the person going to expose to the world adrenal fatigue and cortisol optimization by yoga. Your PhD should be on that way, and you're doing great service to the human being by doing that.
Thank you, sir.
All right?
Thank you,
Sir, Ravindranath sir.
Thank you, doctor. Thank you for coming today.
To do that work very hard. I need to work this young lady because she has taken an excellent topic, yoga and diabetes type 2. That's my favorite topic. You wouldn't believe it. I don't mind sharing this one. Is the health minister, ex-health minister, came to me. Now he is an agricultural minister, came to me with the type 2 diabetes. I completely reversed his diabetes with yoga, meditation, and all the supplements and everything. He came with the 60 units of insulin. He is happy to mention his name to everybody. You know, Dr. Mr. M.R.K. Palaniswamy?
Yes.
He came to me with a heavy amount of type 2 diabetes. With yoga, with all the hormone optimization, with the Kaya Kalpa, I reversed his diabetes fully. So he is happy to mention his name everywhere. He said, "Look, please use my name." And I'm very happy, he said. So why I'm saying that to Dr. Hema Malini, you must concentrate on stress, cortisol, sugar level.
Sure.
This is a must for you, and you will be one of the expert in diabetics management with yoga.
Thank you so much. Thanks for the blessing, sir.
All right, thank you.
It's a good clue. Thank you, doctor.
Thank
That's why we have missed you last 2 months.
Sorry, I was so busy. Now I have to drive this younger generation on the driving seat. I will be
Then
the
you
back
have
seat
to come.
passenger.
Yeah, every Tuesday, please make sure that you are there.
I will be the
We
back
will bring
seat
more.
passenger. They are the main driver. We are the back seat passenger. Me
Yes,
and Dr.
yes.
Ravindranath are all back seat passenger. They are the main driver.
Dr. Aruna, excuse me, Doctor. Dr. Aruna is coming on.
Oh,
She
yes,
will come.
yes.
And
Yes,
Yes,
please.
Aruna. Aruna, come on.
Sorry, I was held up on a call.
Okay.
I have
matter. Go
submitted
ahead.
my PhD thesis with Kayakalpa and deer exercise on with regard to the menstrual problems faced by the adolescent girls. And my research was done at the adolescent camp, which was conducted in 2018 in Aliyar. And at the moment, I'm waiting for my Viva to take place.
Dr. Aruna, can I ask you a few questions, please?
Sure, sir.
What is
Doctor?
your...
She is facing her Viva now.
I'm waiting for my Viva to take place.
Okay, in
You
that
are
case, I
having
can
your
give you
Viva
a
now
few
with
ideas
Dr.
and thoughts to you. You know, my favorite among the whole sky is Sky Kalpa.
Yes, sir.
I every day do religiously Sky Kalpa. I have to be indebted to Swamiji. He taught me rightly by himself. So my favorite topic you've taken it. So I like to give you a few clues for you. Okay?
Sure.
And you are a MPhil in yoga?
PhD, sir.
So you are like a other lady that you done a MPhil and then doing PhD, correct?
No, I have done a direct PhD.
Oh, you done. What is your basic qualification?
MA. I finished MA yoga and then done my PhD.
Oh, you done an MA yoga and
Yes.
you are doing the PhD. You are
Yes,
waiting
sir.
for the Vava. And
Yes.
your thesis was Kayakalpa in adolescents children.
Kayakalpa and deer exercise with regard to menstrual problems among adolescent girls.
Okay, what is your what I call the basic of concept? How did you link Kayakalpa with menstrual period? Tell me. I'm sorry, I'm doing a little like a fine tuning for you, young lady.
No, this is what we were missing you, doctor. Go ahead. It's wonderful.
How do you link the Kayakalpa to the menstrual regularity?
Actually, my mother, Mrs. Asha Gwalani, I think I have seen you. You have come to Coimbatore when Swamiji used to come. I have seen you as a small child, actually. And my mother, Mrs. Asha Gwalani, used to take a lot of interest with the deer exercise. And Dr.
Great.
Rabindranath is to refer all the deer exercise, any woman suffering with the menstrual problems, to my mother to teach them. And when I joined in my PhD, I approached Dr. Rabindranath regarding a topic because I wanted to do something different, something useful for the society. And Dr. Rabindranath suggested, why don't you take up the deer exercise research along with the Kayakalpa? It was a very challenging research. I actually walked up to my guide, at least must be 4 to 5 times. Dr. K. Perumal from Aliyar is my guide. I walked up to him 4 to 5 times. And I, in fact, requested him, I want to change my topic because I did not get support. It was a very challenging
Please don't
research.
change.
No, sir.
Please don't change. I beg you. Please don't change.
I haven't changed. I have completed my thesis, but this is my journey.
Why I'm telling you, you are Dr. Prema, right? Sorry.
Aruna.
Aruna. The other lady is Hema Malini, you are Dr. Aruna, correct? Yeah. Like Dr. Hema Malini took the topic, your topic is brilliant topic. You know why I'm saying that? In my own experience, I've been in the medicine since 70. I passed out in 73. I have seen, when I was a medical student in 72 in gynecology unit, PCOD, if a case got admitted, we run to see the patient because very rarely we see PCOD patient, polycystic ovary patient. Once in a blue moon, in a 1 year, we may see one patient. Now, if you take the young girls, 15 to 20, 30% of the young girls are suffering from PCOD. You got it?
Yes, so, very true.
what I'm trying to tell you is, I am treating in London at the moment 7 young girls. They're only 20 to 23 with heavy menstrual irregularities with problems. You know why? I will explain to you how deer exercise and Kaya Kalpa help menstrual irregularity. I'll give you a little cycle. When you do Kaya Kalpa, as we discussed before with Dr. Karna ma'am, it regulates the parasympathetic and sympathetic activities. So when you contract the sphincters, the muscles, the parasympathetic system, afferent system, take impulses to the brain. That is called hypothalamus. In the hypothalamus, there are 2 nucleus, sympathetic nucleus, parasympathetic nucleus. So when you contract, the impulses goes to parasympathetic, stimulated, and there is a neurotransmitter called serotonin that secretes the estrogen. And this serotonin goes to the uterus, goes to the ovary, makes the ovary to secrete estrogen. And again, same GABA, the neurotransmitters, goes and stimulate the ovary to secrete the progesterone. And again, it balances the cortisol. So the deer exercise regulate the hypothalamus activity, thereby HPA axis, hypothalamo pituitary adrenal ovarian axis, gets regulated. So the deer exercise regulate the hypothalamo pituitary adrenal ovarian axis. By doing this axis, your cycle gets regulated, because this axis get irregular when you don't do proper meditation yoga and this exercise. So it is clinically proven, when you do that exercise, the parasympathetic activity relays the impulses to the hypothalamus, regulate the hypothalamus, and hypothalamus is the master control person in the body. And that controls every activities of the hormones and muscles and heart, every system. This is why these regulate the sympathetic parasympathetic regulations and regulate the hormones, especially ovarian hormones. Thereby you get the normal cycle. So especially the estrogen progesterone has got a ratio. That ratio gets altered when you get stressed. The stress hormone alters the ratio. So I can give you all the link. You can say, this is the scientific mechanism of deer exercise help the menstrual irregularity. So you don't want to put the patient on all the contraceptive pills. That suppresses the ovarian function and shrink the ovary and makes them infertility.
Yes.
So you are helping the society to not infertile, make them fertile, and give them a very good opportunity. Without medicine, you are helping the society in a big way. That is my favorite topic. I really want to give you the boost into that. You must be really doing in depth of it.
Thank you, sir. Sure. I would need the support of the doctors and the organization in the long run to support me. Then only this research can go on. It was a very big challenge. I did face a big challenge with my PhD research, actually.
Please ask my email from Rangasamy Ayya. Rangasamy sir.
Yeah, I will give her. Aruna, absolutely.
I would
it's
like
a lifelong assurance.
I will send
Aruna,
you
please listen. It is
links.
not just this PhD, and you will get lifelong assistance in these areas. All the best to you.
I will get the link, and you are going to talk to all the young the students in those high school students and colleges. Lecture. You have to give that effective sky lectures to all the colleges and school with the scientific evidence. That is your duty. My real request for you, I will give you all the scientific bullets, but you need to take it to all the young girls and the students to effect of the sky practices for regulation of menstrual cycle.
I am willing to do it. That's my dream, actually, because when I went into the adolescent camp in 2018, and when I saw the adolescent girls suffering, that's when I realized that every girl and every woman in the world should learn this deer exercise. And that's why Swamiji came across this in a book. He came across it and he modified it to suit women's needs. so that women don't suffer anymore. And this
I
is my
have to
dream.
thank Muthmani Ayya because he's been reminding me last 3 days, come today. I'm so happy I came.
Thank you.
I want to educate you, and also I want to educate that other lady as well.
Not me.
Go for
Swamiji.
the social responsibility by the Sky Center. Social responsibility. It is a collective social responsibility for the Sky Center. Correct? You have to be collectively. You have to do
Yes,
this.
we agree. We take it. We take it. It's not a challenge. We accept it.
Please.
That is why I called you today.
We should thank Dr. Rabindranath, because it was Dr. Rabindranath who gave me the idea to take over this research and do it. It was a big challenge. I did come to the extent of giving it up, but I think my guide didn't allow me to
You're
do
lucky.
it.
And now you got a link.
Yes, I'm very happy I've got the link.
Indra madam wants to talk.
Okay.
I think that I totally and wholeheartedly second Dr. Jaiprakash, because the interface, like take an example of the diabetic research that this other lady is doing, cortisol level can be measured, you see, and that can be the interface that can be made into a scientific validation. Does Dr. Jaiprakash agree?
Yes, sir. Yes, ma'am.
Yes, yes, yes.
Definitely. You're right. You're spot on.
And so these are the kind of addition that even Aruna can do, or Hema Malini can do, or Dr. Karuna can do, and then collect the data to validate and say, okay, we have this support, validation with the changes that the technology is able to measure.
I agree,
That is
ma'am.
my, so I second Jaiprakash.
I agree, ma'am. I think with the two younger ladies, they have to take the real forward responsibility. They are in the right direction. I'm so glad Dr. Ravindranath given the best title for these two young ladies for the PhD. I'm so happy, Dr. Ravindranath, sir. I really appreciate that you really given an excellent topic for these two PhD students. Really good. Brilliant. I would do my best to give you a lot of scientific literature to back up all your research.
Exactly.
Very good. I'm very pleased today. I met these two PhD students to give them the real way forward.
Very nice, doctor.
Yeah, with the
You
Sky
made it
Center,
today.
you are the main leader for a lot of young people to come in the right line.
So, Varga Valamudan, I'm Shanti, a PhD scholar.
Yes, yes.
Varga Valamudan, Varga Valamudan.
Come on,
Varga
Shanti.
Valamudan, Dr. Jaiprakash, sir. So, I'm doing my thesis, my study on the Sky Yoga for the hypothyroid women, sir.
Good.
So, I would like to hear your suggestions. What are the variables that can be measured?
Again, you got a very good topic, because if you take the 40% of the ladies in India above 40, most of them are hypothyroid.
Yeah.
They all take thyroxine, and
Yes,
still
sir.
they don't again not get better. Even they take thyroxine tablet, they won't feel better. Again, you have a very good topic as well you chosen. That is called thyroxine resistant hypothyroid.
Okay.
Write it down, please. Thyroxine.
Yes, I'm noted down, sir. I'm noting.
Thyroxine resistant hypothyroid. Again, the reason for it, high cortisol. Cortisol is a commander hormone. You know, hormones are all works like a orchestra. Unfortunately, in the modern medicine, they split into many divisions, like a gynecology hormone, thyroid hormones, and they split into many things. But in physiology, all the hormones work like an orchestra. And who is the conductor of the orchestra is the cortisol.
Okay.
When the cortisol, the stress level goes very high, every hormone work erratically. The thyroid work erratically, progesterone work erratically, everything goes in a haywire. So this is why the hypothyroid is costly. When the stress level is higher and higher, cortisol makes the hypothyroid condition very bad. Even when you measure them, thyroxine level, T3, T4 level is normal, still have the symptoms of hypothyroid because those T3, T4 does not work at the cellular level properly because cortisol prevent the T3, T4 to work at the cellular level. That is why it's called thyroxine resistant hypothyroid. So we call them, there are 4 things cortisol does. 1, thyroxine resistant hypothyroid. 2nd, insulin resistant diabetes. 3rd, leptin resistant obesity. Okay. And then another one is the free radical resistance. They don't get converted. So these are the cortisol does it. Unless you reduce the stress by sky yoga, any amount of medicine does not cure hypothyroid. Just giving all the thyroxine, even you could give T3, even you give T4, there are the medicine they give just T3 instead of T4. Any 3T, T4 combination will not be help unless you reduce the cortisol. For cortisol reduction, you need a sky practices. So you must say, you put it into the, if you want a literature, I'll send you all the thyroxine resistant hypothyroid due to cortisol. Again, you need to measure the cortisol for hypothyroid. So for your research also, measure the the cortisol level before and after, how the thyroxine function works out. And also you need to measure the TSH level as well.
Yes, yes.
If the TSH level is very high, that is mainly due to cortisol.
Okay.
So unless you reduce the cortisol by yoga practices, the thyroid does not function properly. Even they secrete enough thyroxine, they don't function.
Okay. Okay. Thank
Scholars,
you.
anyone
Thank
of
you
you
so much.
who is willing to
Thamrai
talk?
Selvi.
Yes.
Thamrai here.
Yes,
And,
yes, please.
I want to just discuss with Dr. Jayaprakash sir. And thank you, Dr. Jayaprakash sir, for your valuable inputs for our research scholars, co-research scholars. And my title is on effect of Kai Yoga and counseling on selected risk factors among stressed middle-aged working women in Huzur. And I just chose this topic to have a shift on medical paradigms, that is biomedical to biopsychosocial. Modern medical treatments now highlights the importance of maintaining mental and physical well-being, as you know. In addition to medicating ongoing disease and psychopathology, moreover, awareness of client-centered care, in particularly taking consideration of client preference of treatment, has increased. Importantly, complementary and alternate approaches of treatment have increases in parallel with this. Additionally, 65% of people in psychotherapy reported using at least one form of complementary and alternative medicines, CAM, in the prior year. It is therefore becoming increasingly more relevant to understand how complementary treatments such as yoga may benefit individuals with mental health problems and how psychotherapists may go about ethically integrating such practices. So my motto is to integrate in psychology field the benefits of yoga and heal and cure or get relief from their disorders, psychosocial disorders. And as you have insisting about the importance of cortisol, I have taken blood cortisol as one of my biochemical parameters, and I have taken my other physiological parameters as BMI and resting pulse rate, and my psychological parameters are stress, depression, and self-esteem, since I have taken the subjects as working women. So I want you to have any valuable suggestions.
Yes, I can give you a very good add-on point to that. You have taken an excellent point. I will tell you again how I teach my patients about the integrated pattern of treatment, yoga and all the things. I tell them, the elephant has got 4 legs.
Yeah.
You have to use all the 4 legs to walk.
To walk. Yeah, absolutely.
You cannot use allopathy alone is one leg, Ayurveda alone is another leg. Integrated therapy is all 4 legs together. Like naturopathy is another leg, like that. I tell them each one is integrated with 4 legs, then only it can walk. So nothing is superior than other. They have to integrate together properly. That's why I convince my patients like set of things. And so they get convinced with that idea. So another important thing in your integrated pattern, I agree with you. One more thing you need to do, especially with the integrated pattern of working together, when you do the cortisol, you do the DHEA level.
Okay, sir.
Dihydroepiandrosterone.
Okay, sir.
When the cortisol gets whacked heavily, the DHEA hormone goes down very badly.
Yes.
Because there is a cycle called all the steroid hormones comes from good cholesterol.
Yes.
When the stress level is high, most of the good cholesterol be used to make the cortisol. So the first hormone to suffer is the DHEA, and the second hormone to suffer, progesterone. I'm sure ladies all know when they get stressed, their period gets irregular, especially near the wedding time or exam time, or where the ladies get immediately irregular period or stop a period. That is because of progesterone steal. Cortisol, when it's excess, it steals the progesterone formation and makes the cortisol. That is why in your measurement, you need to do the DHEA level. DHEA is a very important hormone for immunity and brain regeneration. So, and it's a mother hormone, important for estrogen and progesterone as well. So when you measure cortisol, you also measure DHEA and progesterone. And you thereby, you can say, by regulating the cortisol level by yoga, the DHEA and progesterone hormone gets normal because the cortisol level comes down. So I have to send you a chart how all the hormone integrate with the cortisol. Okay.
Okay, sir.
Thank you.
Thank you. Thank you.
I think Dr. Gupta wants to ask me something.
I think as we are emphasizing, and it is very, like a conductor of the orchestra, cortisol, the new thing that has been added recently is not just the fight or flight, but they are adding now theoretical framework to freeze and flow. So my understanding is that when you understand flight and fight, then first you have to really confront it. That is like you are freezing. Then, with all this understanding, it can flow to wherever it needs to go. So I think that even in cortisol research, they have added this more components to it. So it is not this or this, but what are the solutions through freeze and flow? Thank you.
Thank you for that valuable input, ma'am. I will sure add in my research.
There is a book called Adrenal Fatigue. I will send you the referral to Rangasamy sir. I'll send you the referral to that. You can pass it on to Tamra Shelby. She can look into that. And it will help you to integrate the scientific evidence of yoga in helping integrated patterns in harmony.
Actually, I too, like Aruna, found very difficult to choose this topic because there was a little bit of support here, because integrated therapies are not much encouraged in medical fields, and I have to even get a nod with Niman's psychiatric specialties, expertise, and they said, go ahead, and this is a wonderful, unique topic, and you can go ahead with it, and really a unique, much needed topic of
absolutely. You all three selected an excellent need of the hour topic.
Yeah, thank you, sir. Thank you very much.
I fully endorse it. You all three selected the need of the hour, but please take it to the society. That's very important.
Sure.
With blessings of Dr. Ravindranath sir, you have to take it to the society.
Yes. with
Skype.
all the seniors and elders, expertise people like you, sure, sir, we'll do the need for the
No, I'm
society.
all learning. I'm still learning quite a lot.
With the blessings of Maharishi and Dr. Rabindranath and my Hosur president, Dr. Rangaswamy Ayya, who is always the motivator or factor behind me, and Dr. Shanmugam sir is an inspiration. So with
Oh,
all your
yes.
blessings.
I'm learning from Dr. Sanmayal sir as well.
Yeah, thank you, sir. Thank you very much.
Right.
Today he couldn't make it. He has taken leave now. Leave of
Okay.
absence granted to Dr. Yes. Thank you very much, Dr. Jayaprakash.
Sorry, I've taken much of your time.
We must thank you wholeheartedly. Our scholars are really benefited. Thanks a lot for accepting our invitation today.
I'm sorry I've taken much of your time.
We want you to take it.
Not at all. It is your time.
It's been a pleasure to meet you. And,
You know, Dr. Devi, next
Yes.
time I'm going to ask you a very unique question next Tuesday if I join in. I hope. You know, this is the question. I'm giving a little question. Even now, you have to prepare for the answers next week.
yeah, that's true. Please give me.
You know,
Homework, you are giving homework to her.
No, not homework. To kindle her light knowledge.
Good. We missed you all these months.
What is the first time when I heard about Maharishi in 85, 86? This was, you know, I said to you, the Ramki was the guy. He told me, Maharishi has got a Kayakalpa technique. You can even select a male or female baby. How, if you're indulged in yoga, very intensively by Maharishi technique. And ringing in my head all the time, how that guy told me and how cleverly that this can happen like that. I want to look into that scientific way.
No, yeah. Is it to, at conception, to conceive a male or female baby, or to diagnose whether it's female baby?
No, conceive before conception. To direct the sperm into the right Y sperm into the right way. There is a yoga technique that Maharishi has got the real thing to knowledge to share people and educate or
it is there in the Siddha literature.
Yeah.
To have the Idanadi and Pingala Nadi.
Yes.
That is, corresponds to the parasympathetic and Pingala corresponds to the sympathetic. So at the time of intercourse, if the man has his sympathetic flow or the Pingala Nadi flowing, it will be a male child. If he has his Idanadi or the parasympathetic Nadi flowing, it will be a female child.
That is why the female child are more intelligent, parasympathetic.
It is there in the Siddha literature.
That's good. I'm so glad you said that because that's been ringing in my head for a long time. I had to ask a gynecologist like you whether it is. That's good.
Dr. Jayaprakash and Dr. Sendra, I want to tell you this in one of our sessions, we said we must go through all the old Anbali issues. And I really got something like 25 to 26 years books, old volumes of our Anbali, and very clearly answer is given by Maharishi. For your question, it is there. Next week when you come, I will give the reference to Sundara Devi, so she can easily give you the quotes and unquotes. Okay.
Excellent.
Thank you.
I'm willing to learn a lot from you all.
We've been talking in this group for a long time, going round and round, saying that all the effects, yoga is, my view is yoga is always the best parasympathetic activator. And that is how yoga brings on its results. So that's been, I've been stressing it in this group, but we didn't have the support like you have about the cortisol. And of course, when the sympathetic system is balanced, the cortisol secretion is balanced. So that is, we have been discussing it, but you have given us solid evidence and guidance for that. Thank you.
This is why I was talking to Dr. Rabindranath Ayya. I'm going to bring the lab to Chennai soon.
Yes.
The salivary hormones and salivary cortisol level, 4 cortisol level of saliva. Because when you put the needle into the vein, the pain itself increases the cortisol. So the level might be misinterpreted. If you do saliva cortisol, it's very easy, 4 levels. You can really see the fluctuation of the diurnal variation of the cortisol. And thereby the linkage between the cortisol with other hormones can be easily, proportionately done really well. And especially for infertility, the menstrual irregularity with PCOD, one of the best tool to do that.
Yeah. See, I have been doing acupuncture for 8 years.
Yes.
I've cured a lot of girls, about 100 girls with PCOD, just with yoga, Kayakalpa and acupuncture. So a lot of girls, obesity have treated, and infertility and PCOD also. Only thing is I haven't.
I'm so glad you're not prescribing the
now she is disclosed another area.
No, I'm so glad you're not prescribing the contraceptive pill to the young girls, and you're not prescribing to the metformin to the young girls. I'm so glad.
But the thing is, I haven't collected the evidence, records, and things like that. So,
Excellent. I've been
Kayakalpa works wonderfully in the male infertility also. Acupuncture plus Kayakalpa. I have treated so many male infertility. I've written a book on it also.
Excellent.
Acupuncture and infertility.
I have a small book to share with you, written by Dr. Abdul Qadir. He is the one who worked with me on Kayakalpa.
Yes.
And on physiology of hormones and fertility. And optimizing the physiology of the hormone. Optimizing the physiology mainly by yoga.
Yes.
Rather than all the chemical stuff.
Very nice, sir.
Thank you.
Thank you, sir.
Thank you. It was very enlightening for all of us, including the scholars, Sky scholars. They are very lucky today to interact with you. Once again, we want to thank all of them. Any other question which anybody else would like to ask? You can unmute and come.
Indra madam.
Okay, there is talking about infertility. There is a professor, Sky professor in Ooty, Dr. Satyamurthy. I think he may have some data in this regard. So we can tap into what he's doing recently, or if he has any data, because he has helped many people who were infertile, so having children. And you know how Kayakalp or the exercises helps to activate those hormones. It needs to be tapped into to get some data, get some, how it is connected, all these things. It can be a good research project.
Yes, ma'am.
And this all falls into, I'm telling you, strategic activism for interface. Thank you.
Okay.
Thank you, Indiraji.
So, wind up the show, sir.
Yes.
Anyone you are left in this group? Still 17 people are there. Glued to their system. Vijay is missing today. Vijay, Indiraji, where is Vijay?
He is on his computer in the study, and I'm in the media.
Give him.
Okay.
Okay, thank you.
Vijay.
Dr. Jayaprakash is calling you.
Thank you.
They have written a couple of science magazines. I think I will have to send it to Dr. Karuna, all those things. Okay. Dr. Karuna, I need your email ID. You put it in the chat box. Yeah, you give me your email ID. Yeah.
Asking, here's Vijay now.
Welcome, sir. Welcome. See, from UK, Dr. Jayaprakash has come and you are hiding.
Hello, sir.
Yeah. Hello, sir.
Good to see
So
you.
thank you very much. Thank you
Friends,
for encouraging us. And
bleeding
we have
இருக்குதாங்க?
had a wonderful session today.
டாக்டர் ஐயா மஞ்சசாமி ஐயா உங்க இது மியூட் ஆயிருக்குது.
Okay.
Okay.
Sir, can I ask a doubt on today's topic?
Yeah, go ahead.
Sure.
Quick.
Anyone can answer this on doctors, anybody. Actually, we are today we have spoken about this spasm and our pelvic muscles, and the thing is actually doing practicals while doing practical asanas or exercise, whatever this thing, is the spine should be strengthened to get strengthening of this pelvic muscles, because spine today, as of now, we know in due to modernization and a lot of gadget use, the posture itself has become convex. It is not concave. So we are not standing erect. So what is your views on this? Anybody can give me a clarification. So how well this Kaya Kalpa will be benefiting because of this culture which has been bent down of our shoulder or spine is not erect. Because usually we say human spine, if it is erect, we will be healthy.
Dr. Ravindra Ji.
See, it is a fundamental practice to keep your spine erect. And meditation, you keep it erect. For even the exercise which you are doing with the convexity of the spine, the vital capacity, the air getting into the lungs and coming out of the lungs decreases enormously. And when you keep your shoulders retracted, it facilitates easy expansion of the chest. So it is fundamental, and it works like that.
Okay, thank you. Can we,
Sir, it is
if there are
10:10.
no questions, can we close it?
All are waiting for it.
Okay, thank you very much. Let me first thank Dr. Palaniswamy, and he has given a wonderful topic on this pelvic floor anatomy and application in clinical disorder of psychosomatic nature, followed by quite a lot of interactive session with Dr. Sendraji, Dr. Karuna, Dr. Dhanapati, and Dr. Indraji. And of course, Dr. Shanmugavelu could not remain for long with us. He has to go in a hurry. But Dr. Sandhya was introduced today. It was a great thing. And we want to congratulate all the scholars who are interacting with our great Dr. Jayaprakash. And morning since I have been praying and sending messages to him, somehow you make it today. And he made it. And it was a great thing. Thank you, Dr. Jayaprakash.
Thank you,
And
sir.
I am sure you also enjoyed it. So
I
you better
really
make
enjoyed
it at least once in a way.
I
Like
really
this, you
enjoyed
appear, guest appearance. In fact, we
Really
prefer
enjoyed it.
every time if we can make it on Tuesdays, even
will.
for half an hour, we will be delighted.
I
And you continue to interact with our scholars so
Yes.
that they will definitely give a wonderful presentation of their projects and also service. You know, they are so much motivated, and you have been telling me from the first day that younger generation should be brought up, and the same view of Dr. Indraji also. So we will definitely live up to that expectation, and we want to thank all of the participants who were today. And it was a great show today, and you made it very entertaining and useful and wonderful. Clues you are given to them, and they will take it forward. I want to assure you, doctor.
Thank you.
Thank you, Dr. Ravindranath ji, for your vision and making this as a very interactive session. Thank you, Dr. Dhanapati also, who have been patiently. For his sake only, we reduced the time to 8 to 10 o'clock. And thank you very much, all of you. Good night. Good day to this Indraji and all.
Thank you.
Thank you. All be blessed by the divine. Thank you, Vijay. Thank you for a guest appearance like this.
Good night.
Good night.
Good night.
Good night.
Good night. Good night.
Good night. All your
Thank you, Muthamani Ayya.
காலையில தான் டாக்டர் ஐயா.
Thank you, Jayaprakash sir. Thank you so much.
Thank you.
காலையில
Thank you, Karuna.
காலையில நானும்
Karuna, you give me your email ID.
Sir, I've sent the email ID in the chat box.
Yeah.
I've sent it.
I will forward that papers to you.
Okay, okay, sir. Also, Jayaprakash
Thank
sir's email ID.
Yes. We share it.
Muthamani, you give it to
Yes,
me.
we share it. We share it.
Okay. Oh, okay. Thank you then. Thank you. Bye.
Okay. Bye.
Okay, thank you.
Good night,
Thank
good
you,
night.
all of you.
Bye.
Bye-bye to our US captains.
Bye.